round Brussels tumors in the pediatrics. As a medical doctor, you must know those 5 round Brussels tumors. You can even forget other things, but don't forget small round Brussels tumors. So, any question before we go to the bone tumors? Any question? Any question? Sorry? Any question?
Yes.
For example, before you have to use also this link. To know those tumors. You see, there is a long list of tumors. There's some glio. Diffuse glioblastoma, the other things, there are so many. Non-glio tumors, meningioma, non-neoplastic. But let us see if we see some images of medulloblastoma. Pandemoma, oligodendroglioma. Let us see the embryonic tumors. For example, this one medulloblastoma. This is a medulloblastoma. Neurocytoma. This one, it is involved on the neuron. So this is to show that there are several images in neuropathology. This is where you have to keep the most important for you, because neuropathology is a subspecialty of pathology. You can't finish pathology, neuropathology here in 3 hours. It is not possible. Let us see the bone. Tumors of the bone. Like brain tumors, also the radiodiagnostic is very, very important diagnosis of the bone tumors. Before a surgeon must do the radiology. Then after radiology, there is surgery. Then after surgery, there is histopathology. So the for bone tumors involving bone or simulating bone, radiograph is the gross examination. It can be classified benign or malignant, and also to say the location and invasion of the tumor. They say benign lesion tend to be clear, defined well circumscribed, well off by a layer of reactive bone, whereas aggressive lesion, which include infectious or malignant lesion, tend to be poor circumscribed, reflecting the infiltration of surrounding bone. Aggressive lesion tend to produce onion skin, spiculated or discontinuous periosteo reaction. This is the radiological image. Let us see the bone forming tumors. First of all, how does bone form? This one I have seen in endochondral ossification, I have seen it in histology. In intramembranous ossification, I have seen it in histology. I don't repeat again. The most common benign forming neoplasm is the osteoid osteoma. This is a benign tumor of the bone. The region is composed of small, inferior to 0.1 centimeters, surrounded by dense sclerotic zone. This one is different from osteoblastoma, essentially the same region histologically, but it is larger. When it is over 1.5, it is called osteoblastoma. At the other end of the spectrum lies osteosarcoma. The conventional type is high-grade sarcoma. The usual appearance is that of high-grade spindle cell neoplasm, and it is the most common tumor, malignant. This is an image of the osteoma or osteoblastoma, depending on the size. Osteosarcoma is malignant and it has some variant. Example, osteosarcoma, periosteosarcoma, and others. So whenever you see osteosarcoma, it is a malignant. And what I can tell you, once you suspect osteosarcoma, you call a surgeon for quick diagnosis. Because if there is osteosarcoma and it delays in the taking of chemotherapy, this one can spread metastasis easily. This is why when you suspect osteosarcoma, immediately you cooperate with a pathologist for giving emergency for the diagnosis. There are some cartilage forming tumors, like those osteochondroma and osteochondrosarcoma. Of osteosarcoma, there are some enchondroma. These are benign tumors of the cartilage. Chondroblastoma is also benign, but chondrosarcoma is a malignant. This is an image of enchondroma. This is Osteosarcoma. You see they are polymorphic in size and shape. There are some fibrous or miscellaneous tumors in the bone, like fibrous dysplasia. This is the lytic and the fibrotic region, mainly in long bone and craniofacial bone. There is what we call giant cell tumor, adamantinoma, Ewing sarcoma have seen. There are some joint regions like synovial chondromatosis, accumulation of benign cartilage. This is an image of Ewing sarcoma. So in summary, this is what I can say about the bone tumors. The most common malignant is osteosarcoma. Maybe we'll have, I don't know if in the lobins there is an image where there is location of tumors and the age, because also it affects. But most of the time, clinic does not diagnose bone tumor. It is just suspicion. There is some tumors called ossifying fibroma and non-ossifying fibroma. These are also common for those who did the dentistry. You will see those tumors in dentistry, ossifying fibroma and non-ossifying fibroma. This benign. So this is what I can say about the bone tumors. Other things we see it in some practicals, and you can also read about the Robins. Let us see what Robins say about the tumor, if there's some location and the I don't know, maybe it is not in this book. If I have, I will share with you. Here there is the location of the tumors and the diagnosis. What I see, this one is the osteoma. It is benign. This is the major site of osteosarcoma. 50%, this one, the femur 15, then 10%. This is an image of the osteosarcoma. This is the endochondroma. Chondroblastoma, chondromyxoid fibroma, this is a fibrous dysplasia composed of clevicular trabecula of woven bones that lacks conspicuous osteoblast, rimming and rising background of fibrous tissue. Let us see the images on the website. You see bone tumors, osteochondroma, chondroma, chondromyxoid, osteoblastoma, osteosarcoma, sarcoma, chordoma, adenoma, fibrous. See, there is a long list of disease. Tumor-like lesion of the bone, for example, let us see some images of those. Can see ossifying fibroma. Now let us see the common osteosarcoma. Here you see some more geographical images. This is an image of osteosarcoma. So, take-home message is that osteosarcoma is an emergency. Once you want to make a biopsy, please cooperate with a pathologist for a quick diagnosis, because once you touch on the sarcoma, it is increasing in size, metastasis. This is why most of the time we do a frozen section and you give directly diagnosis, and then the patient will start chemotherapy and radiotherapy to prevent the metastasis to the lung. The first diagnosis is not for osteosarcoma, is not surgery. Most important is chemotherapy and radiotherapy. Maybe surgery will come after, but the most important is chemotherapy and radiotherapy and quick diagnosis without a delay. Any question about the bone tumors? Any question? Any question? Any question? Any question? Any question?
No question.
No question?
No question.
Okay. Next time we will see the lung, liver, and the pancreas. Okay. Then after that, we start programming the exam, the vision, and some practical session. So next time we see the lung, liver, biliary tract, and the pancreas. Is it okay?
It's okay.